Good morning, everyone, and welcome to this webinar on widening access to healthy food. We're going to be highlighting some great examples of work happening in Glasgow today. This session is brought to you by the Glasgow Food Policy Partnership and supported by the Glasgow Centre for Population Health Communications team. And it's part of our work to support the implementation of the Glasgow City Food Plan. It's the third in our series of webinars sharing information and learning about improving the food system, and it will be recorded and available online after today. I'm Jill Murray, and I'm a Public Health Programme Manager at the Glasgow Centre for Population Health, and I currently chair the Glasgow Food Policy Partnership. For a number of years, I've been involved in the development and now the implementation of the Glasgow City Food Plan, which is a 10-year framework to build a food system in Glasgow that's fairer, healthier, and more sustainable. Launched in 2021, the Food Plan brings better coordination and collaboration to the work of the public, private and third sectors to make Glasgow City where tasty, healthy, affordable food is accessible to everyone. There's going to be 3 presentations today, followed by a panel Q&A session. If you have any questions for our speakers, please use the Q&A function online. We'll do our very best to get your questions answered, but we might not have time to ask all of them due to the high numbers of attendees joining us today. We would ask you to use the Q&A function only for questions rather than general comments. Our events team will be using the chat function to post links that are relevant to the presentations. So without further ado, I'm pleased to introduce our first speakers, Jonathan Pauling and Ashley Hall from the Alexandra Rose Charity. Jonathan is a Chief Executive who's been with the charity since 2014, developing its work to improve access to healthy and affordable food for all. Jonathan built the Rose Vouchers for Fruit and Veg project to pioneer the use of financial incentives to help families on low income avoid food poverty and diet-related ill health. The work has grown from a small pilot in London to a UK-wide initiative, including work in Glasgow, which you'll shortly find out about. Ashley has a background in project coordination and has worked in the corporate sector and not-for-profit organisations before joining the Alexandra Rose team. Her previous role was at a small local charity where she ran projects to improve mental well-being and reduce social isolation across all age groups. Ashley has been particularly helpful in supporting work in Glasgow. Thank you to you both for joining us today, and I'll hand over to you now.
Thank you, Jill, and thank you very much for inviting us here today, and thanks to the Glasgow Centre for Population Health. Yes, it's great to be here today and to talk a little bit more about Alexandra Rose Charity and the Rose Vouchers for Fruit and Veg project. Alexandra Rose Charity's actually been around for a really long time. It's been around for 112 years, but its focus for the last 10 years has been on developing the Rose Vouchers for Fruit and Veg project in round about the early sort of 2010s. We saw the rise of food insecurity in the UK following the great financial crash, but we also saw the inextricable rise of food-related ill health in the UK, and the charity wanted to do something about that. And so our current mission is, our vision, is for everyone to have access to healthy and affordable food. And our mission is to give families access to fresh fruit and veg in their local communities. And like I said, we do this through the Rose Vouchers for Fruit and Veg project. We were really inspired, in fact, by work that we saw coming out of the United States. In the US, there is a long history of food insecurity and food poverty and food bank movements and surplus supply chains supporting people in a need of emergency food aid. And there was a group of organizations in the early 2000s who wanted to look at a different approach to tackling food insecurity, but also promoting healthy diets. So a large number of families in the US are in receipt of what are called SNAP benefits, or used to be called food stamps. And a lot of those SNAP benefits are used in large format supermarkets and on food that's not necessarily the healthiest for people. So a benefit that's supposed to be alleviating financial inequality is sometimes exacerbating health inequalities. And these organizations wanted to see if they could incentivize people to purchase fresh fruit and veg if they doubled the value of their SNAP benefit and encourage them to use it at local markets to buy fresh produce. And those were hugely successful and grew across the United States. And we thought, well, wouldn't it be great if we could trial a similar approach here in the UK? So in 2014, we set up 2 small pilots in Hackney in East London. And the idea there was that we were targeting families with young children on who were at risk of food insecurity. And the reason for that is that the only sort of equivalent that we have of SNAP benefits in the UK is the Healthy Start, or Best Start as it's known in Scotland, benefit for families, pregnant women and families with young children under the age of 4. So we decided to target that community also because that's an area where the impacts of a healthy diet are likely to have really significant outcomes, because transforming diets in the early years leads to long-term health and well-being benefits as well. So we partnered with local children's centres and local early years providers and community groups to engage families who could benefit from the programme, and they pick up their vouchers on a weekly basis and take them to local street markets in Hackney to redeem them for fresh fruit and veg. The programme in the first pilots was a huge success. Evidence base has sort of been replicated over all of the evaluations that we've done since, but on average, everyone in the family increases their portions of fruit and veg by 3 portions a day, which is a huge increase. And at the start of the program, only around 7% of children are eating 5 a day. By 6 months, 64% of children are eating 5 a day. So that's a massive increase in consumption. So on the back of these really good, encouraging results, we decided to try and expand the work because we knew that it could benefit more families and more communities in need. So it started small in Hackney. We expanded into Lambeth and Hammersmith and Fulham in subsequent years. Barnsley in South Yorkshire was the first project that we did outside of London, and that was soon followed by Liverpool. And then in recent years, we've opened up in Tower Hamlets and Glasgow started in October 2020. Since we started in 2014, over 2.8 million pounds worth of Rose vouchers have been redeemed at local markets, independent retailers and greengrocers across our network. We work with around 67 different children's centres, early years providers, family hubs, community groups to distribute those vouchers and engage and support families. And it's about the wraparound support that those organisations can provide to people on the programme. So it's not just the voucher that they get and the fruit and veg that they get, but it's the wider support they get from engaging week in, week out with these services that can help them with, you know, a range of challenges that they're facing in their lives. We work with 60 market traders and independent retailers, and we also have 2 mobile fruit and veg vans which operate in Liverpool, and that's all about improving access to fresh fruit and veg in areas where access is a real challenge. But it's not just about the impact that it has on the health and well-being of people on the project. It's also about supporting the local sustainable and healthy food economy, because, you know, in the end, we all need access to good, healthy food, and we need retailers to survive and thrive to sell us that food. So we've done some economic impact assessment that's shown that for every £1 Rose voucher that goes into a local market, it generates a total of £3.12 of local economic impact, because that money stays circulating within the local economy. And unlike if it was used, for example, in a supermarket where most of that money would leave the local economy and go back into shareholder pockets, this stays circulating more locally because market traders spend in the local community as well. And just to sort of update you on how the organisation is developing this model over time, we knew for a long time that you know, the benefits of this approach could be felt by communities and individuals outside of the sort of narrow focus of early years. Food insecurity is a massive challenge for many people, and food-related ill health is still on the rise. You know, so we have challenges around cardiovascular disease, type 2 diabetes, overweight and obesity, certain types of cancers, all related to poor diet. So we had for many years wanted to trial an approach called fruit and veg on prescription, whereby we work with local GPs, local social prescribers, and community health organisations to give out our Rose vouchers to people who are struggling with long-term health conditions that can be improved by better diet. So we started these pilots in 2022 in 2 London boroughs, in Tower Hamlets and Lambeth. And we have 120 individuals who are receiving these vouchers. And we're just this week about to launch a big evaluation impact study that we've completed that's showing a massive impact this work is having. So again, huge increase in consumption of fruit and veg, reported improvements in health and well-being, and really interestingly, around about a 40% reduction in GP visits during the time that people are on the program. So it's actually improving their health and making them come to see the doctor less because they're managing it better themselves and at home. So that's just a whistle stop about everything that we do at Alexandra Rose Charity. But we've been working, like I said, in Glasgow since 2020, and that has been a really a valuable experience for us and really exciting to work in the context of Scotland. And I'll hand over to my colleague Ashley to tell you a bit more about the project that we're doing in Glasgow.
Thank you. So Glasgow specifically, I look after Glasgow and the development of the project there. We currently work across 5 children's centres and community centres there. So they predominantly are all voluntary led. So we work in Refugee in the city centre, Church House, Barrowfield, Drumchapel and Rockersey most recently. So all of these have a very different demographic of people, but all fit the criteria to get Rose vouchers. So we help right across the city with hopefully in future more plans to help more people in a wider area. So as Jonathan mentioned, we just work with independent retailers. So no big supermarkets, no chains, predominantly markets. However, in Glasgow, there isn't a great market scene, although hopefully that will improve in future. So on the right-hand side here, you'll see we have we work with a stall in Bridgeton. And more recently, we've moved to Food Fair, which is in Drumchapel, and also Scottish Pantry as well. So they're all retailers for us. And as Jonathan mentioned, keeping the money in the local economy. So all of these across the city keep the money locally. So some stats. So since starting the project in October 2020, we've supported 381 families with just over £176,000 worth of vouchers. So if anyone's good at maths, three times ish, the 176,000 will give you the amount that's come in the local economy. So yeah, quite a lot of money that stayed, which is lovely. So future plans for this project across Glasgow. The main things for us is raising awareness of the project and building relationships. So we've had some really nice successful relationships with the Scottish Pantry Network and Thrive Under 5, Centre for Population Health. Everyone's been really, really supportive of our project and we've made some really good relationships and connections. So we would like to continue that and build some strategic partnerships around work that's happening with the food plan, as well as how we can link in with that. We would also like to increase the number of families and children that we can help. And they're obviously all linked together. So raising awareness will raise funding and the number of families that can benefit. We would also like to link in with any of the local authorities or the government to reduce diet-related ill health, which is part of the mission of the charity overall. So that's all from us, and we'll take questions in the Q&A session in a little while. Thank you.
Fantastic. Thank you so much to you both for such an interesting presentation and looking at the wider work of the Alexandra Rose Charity, as well as what you've been doing in Glasgow and working with the partners that we have across Glasgow. Lots and lots of really interesting information there, and lots that I think we can delve into in a little bit more detail in the Q&A. So thank you very much. The next speaker this morning is Siobhan Boyle, who is our Health Improvement Lead at Glasgow Health and Social Care Partnership. Siobhan has worked in the field of health improvement for over 25 years. Her initial employment was with the voluntary sector, working with communities in a development role with young people, and then as a development worker in a community food initiative. Since 2009, Siobhan has worked within Glasgow Health and Social Care Partnership in the health improvement team there, initially with a child and youth remit, and then a lead role for early years. Siobhan is currently the lead for the Thrive Under 5 project in Glasgow, which he's going to tell us more about today. Siobhan also has a lead role in the Health and Social Care Partnership's food work and is part of our core team here in overseeing and working on progressing the Glasgow City Food Plan. So I'm delighted to welcome Siobhan to talk a little bit more about the Thrive Under 5 project. Thanks, Siobhan.
Thank you very much, Jill, and to everyone for having me along today. I'm going to talk to you about the Thrive Under 5 project in general, but also in relation to the partnership working that we've been doing with the Alexandra Rose Charity and the Scottish Pantry Network, which has already been mentioned today. So I will move on and speak to you about that, but also just to say that this really does connect with the overall aims and objectives of Thrive Under 5, and it's been excellent the way that the partnership work has developed over time. So in relation to just some background information about the needs for Thrive Under 5 and how it was developed. So currently in Scotland, 24.4% of primary 1 children in Glasgow are at risk of being overweight and obese. So that's about a quarter of children as they go into primary 1. And the Scottish Government outlined an aim within their delivery plan to have childhood obesity by 2030 and significantly reduce diet-related inequalities. Now, outcome 1 in delivery plan is that children have the best start in life and eat well and are a healthy weight. So on the back of that need, Scottish Government provided funding to strengthen support from birth to primary 1 and favoured a preventative approach. So from that Thrive Under 5 developed, NHS GGC put in a funding bid and they were awarded funding initially for a 1-year pilot to be delivered in Glasgow HSCP. And then in year 2, they applied for more funding, included an additional area, and that was Port Glasgow and Inverclyde. And year 3 included a rollout of elements of Thrive Under 5 to the wider board area. And further funding has recently been confirmed for the project from the Whole Family Wellbeing Fund, which will involve a wider reach model of delivery. And this extends the work of the project to the end of March 2026. So the work in Glasgow. The work in Glasgow initially has been within 3 Glasgow neighbourhoods. And I use the word neighbourhoods loosely because we have looked at the areas and made them bigger in relation to kind of local partnerships within the area. So for South, it's Priest Hill, Houselwood, Nits Hill and Pollock, where we have Thrive Under 5. North East, it's Ricasey, Garthamlock and Cranhill. And for the North West, it's Drumchapel and Blairdardy. Now, for each of those areas, we have a health improvement senior member of staff who's allocated. So they're a part-time worker. And we chose those neighbourhoods initially by looking at the child poverty reporting, the children's health and wellbeing processes, and all of that was kind of endorsed by the HSCP's Children's Wellbeing and Mental Health Group. The evaluation of the project is ongoing and it's been supported by Glasgow Centre for Population Health. Okay, so just in terms of the 3 staff that I mentioned that are working within each of the areas, they have each established a local Thrive Under 5 network, and that's been put in place to help us identify and address barriers to families to enable access to healthy, affordable food and physical activity opportunities. There was a mapping that's been done in each of the areas about the organisations that are currently there, the existing assets, which contribute to that end. So each of the seniors have basically created Google Asset Maps, which have pulled that information together, and they've also included work that Thrive Under 5 has developed along the way. To start off the process with the networks, we also had a community grant process. We had £7,500 allocated to each area. And what we were asking for was submissions of projects and pieces of work that really chimed with the ethos of Thrive Under 5 and our aims and objectives. And we got a whole variety of excellent applications that came in and work that developed at local level with people within the organisations who knew what their local people within their organisations wanted. So I suppose just in terms to bring that to life, we had a variety of work that happens. We had an autumn food festival, which involved volunteers from the Crazy Pantry. We had the establishment of an infant feeding group. We had the creation of a community garden in one of the nurseries, and that's just a few of the projects that materialised. So the referral pathway, so Thrive Under 5 is in two parts. So we have a universal component of Thrive Under 5, and we've also got a targeted approach within Thrive Under 5. And our targeted approach is through the form of a financial inclusion referral pathway. And also, I suppose, our Alexandra Rose Charity work partnership is also targeted. So basically, with our financial inclusion pathway, we work with the provider provide income maximisation support to help people get their entitlements that they need. And also over and above that, we've got a helping hand of supports that Thrive Under 5 brings that can be passed on to families. So just to give you a little flavour of some of the extra enhanced supports that Thrive Under 5 brings to the wider financial inclusion check. So we've got an 8-week supply of meal packs. So that's a meal pack that goes to a family once a week for 8 weeks with a recipe and all the ingredients that they need to cook that meal from scratch. We also have a membership for the local pantry, a free membership and 12 free shops for families. And also we provide support with fuel. So it's a £49 fuel voucher and a £20 voucher for cooking equipment, just for some of the basics, if that's a barrier cooking at home, such as pots and pans, oven trays, that type of thing. Okay, so in terms of Thrive Under 5, central to it also is about helping families build skills and confidence. So some of the resources that we have produced are in relation to the meal packs that go out. We've created recipe cards that correspond to those meal packs. And along with that, we have a cook-along video. So on the recipe cards, we've got a QR code that takes you straight to a video that shows you that meal being cooked from scratch. And also we've been running community cooking demos in the community as a way of families to come and see those items being cooked live, but also to learn more about all the supports that they can receive as part of the Thrive Under 5 project. And also at those meal packs, at those sessions, recipients went away with a meal pack also, which was great, so we can try it at home. Okay, so in the 3 Thrive Under 5 areas, we also have 3 weekly family physical activity sessions. So we've got 2 sessions per week that are happening in each area, and one's aimed at 0 to 2-year-olds, and it's called Womb to Move, and it's baby sensory based and looking at tummy time and that early activity. So that's along with the parents of the children come along with their child to take part. And we've also got the Fit by 5 sessions, which are for age 2 to 5, and that's more physical fun activity, and that runs in those areas also. And Early Years Scotland are our delivery partner who do that for us in collaboration with the families. So we've got funding for that project until the end of this year, and it's been evaluated with GCPH, and it really contributes towards children meeting that physical activity guideline and encouraging that early habit formation and involving parents and carers. Okay, so in terms of capacity building, what we want to do is leave a legacy with Thrive Under 5. So we'll be providing appropriate training for local services in the communities to help staff and volunteers support local families with healthier lifestyles. So we've been running Train the Trainer, how to run a cookery group course, which basically trains people, be that a staff member or a volunteer, to have the necessary skills and knowledge to be able to run their own cookery courses. We've also run Rehis Food Hygiene courses, Rehis Food and Health courses, and also we've been promoting the Henry training, which is an approach that's been rolled out in the board area in HSGGC, a suite of training working with health, early years and family support practitioners to give them the skills to support families to make sustainable changes at home. So it's helping with those conversations and being able to initiate those healthier lifestyle conversations with those they work with. And also alongside that, there was a need as well to look at what groups that we could run in communities to support families themselves with healthy lifestyles for their children. And just now there's 8 pilots of Henry parent group programmes and workshops for families with children aged 0 to 12, and they will start in June 2024 in each locality across the board area. And for Glasgow, Early Years Scotland gained a contract to lead on that work for North West Glasgow and the South area provision, and Peak in the North East will be covering the North East Glasgow area. Okay, and just to give you just a snapshot as well of a project that we have running currently in relation to capacity building, and that's the Yes to Veg project in partnership with Nourish Scotland. And that project aims to make it easier for children under 5 to eat and enjoy vegetables in a fun and interactive way. And we are looking at, making improvements to the food environment, making vegetables more accessible, and helping children under 5 to take an active role in the process. And the Glasgow pilot has been evaluated with the University of Glasgow. So initially, for Glasgow, we've got 6 nurseries involved, 2 in each of the Thrive Under 5 areas, and we've linked with a local organic supplier, focusing on 2 types of vegetables each week over a 4-week period, making vegetables a routine and normal part of the children's surroundings at nursery, embedding vegetables in activities already happening at the nursery, so getting the staff on board to think creatively about how they can do that, and empowering children to take an active role in their food environment at nursery and home. And we're sharing the vegetables of the week with parents and carers to take home, so that can then be brought into the home environment. Okay, so now just to bring in terms of our partnership with local community pantries and Alexandra Rose Charity, which all chimes with what we're here today to speak around. So we are working closely alongside the pantries and existing providers of food support in the 3 Thrive Under 5 areas to reduce barriers to accessing healthy, affordable food in the community. So we've been, since the beginning of Thrive Under 5, we've been in conversation and discussion with Alexandra Rose, and the pantries have been an essential partner in the project by Ashley. And we have basically 51 families and 135 children that are being supported in Drum Chapel area just now through a partnership with Thrive Under 5, Alexandra Rose Charity, Daisy Drum Chapel and Food Fair, the picture that you've seen on the slide, the greengrocers. But also we wished, that's been going for about 2 years, but we wish to then extend to the Casey area, and we got some funding from NHS GGC to do that. And that's when we were in conversation with the Scottish Pantry Network, with the Casey Pantry being the outlet that was chosen to provide the vegetables within the community. And from that partnership, which has been running for over a year now, we've got 52 families, 104 children and 5 expectant mothers who are being supported in the Casey area. So it's really an excellent piece of work that's been going on in the area. And I'll just move on just to discuss just some of the benefits that this partnership's had for us at Thrive Under 5. So in relation to the relationship that we've had with Alexandra Rose Charity and what is provided through the charity, it's really provided us with that solid infrastructure of expertise, monitoring and evaluation in the model rollout. The charity has been able to provide operational models for best practice, such as using the pantry when we didn't have a local greengrocer who could provide that function, and all the added benefits that that brought, and continual liaison for information and advice during the implementation stages. Also, Alexandra Rose have been supporting us with training for the host organisation and with the supplier of fruit and vegetables and that ongoing support. And also, as was mentioned by Jonathan, with the eligibility criteria in relation to Best Start, it's ensuring that recipients that we are supporting are those who need the support. And really, overall, it's enabling the provision of support and ensuring that recipient families have access to a wide range of fruit and vegetables for their whole family to enjoy, which really ties in with Thrive Under 5's aims and objectives in that support package for families. So in terms of the partnership that we have with the Casey Pantry and with the Pantry Network, it really was quite amazing in relation to the speed of recruitment of families for the work that was happening in Casey, because the pantry had the relationship with families and they were trusted and very quickly could identify the families who needed this support. Also within Casey, there is a volunteer involvement, and it's a great sight to behold. I was up there one day when the fruit and veg arrived at the pantry, and the volunteers are there to to meet that delivery coming in, being involved in unpacking the fruit and veg and making up the orders. And the orders of what's in the bags is in liaison with families and order preferences, which happens as well through the pantry. Now, the redemption rate for vouchers or for fruit and veg to be redeemed is so high. It's way high 90s, and that ensures the engagement and access of those vouchers being redeemed and people getting access to fruit and vegetables. So we can honestly say that more children are eating fruit and vegetables on a weekly basis, contributing to the operational aims of Thrive Under 5. And with families going into the pantry, also it's allowing those visits to take place on that weekly basis, and awareness being raised of Thrive Under 5 wider supports on an ongoing. Okay, so just to give you some information, I suppose, on the future aspirations for this partnership. So we wish to continue the provision and partnership in the North West and North East Glasgow areas. And we also wish to extend provision of Alexandra Rose voucher scheme to the South Glasgow Thrive Under 5 neighbourhood area. So we're in discussions just now about how we can actually do that. Also, we're looking to support each recipient of those vouchers in the Thrive Under 5 areas to access the financial inclusion pathway and wider supports that the Thrive Under 5 project brings. So that's enabling connections across this whole system approach. And we're also looking to continue to monitor and evaluate to show the impact of the Rose Voucher Scheme within Thrive Under 5 by case studies from recipients. And this project in itself aligns really closely within Glasgow City Food Plan, where it currently features, and within the new Cash First Partnership project for Glasgow City. And I think this piece of work also is a demonstration of the project benefits within the Thrive Under 5 project. So we will be featuring it within the overall evaluation report for Thrive Under 5. And there's a new updated report currently being drafted for the project. I've also got a little promotional film on Thrive Under 5. And there's the details for myself and also the area contact for North West, South and North East, if you wish to get in contact with staff directly and find out more about what's going on and how to get involved. Thank you.
Thanks so much, Siobhan. That was a really fascinating run through of what's been happening in Glasgow over what is a relatively short period of time over the last 3 or 4 years, and how the project has expanded in those areas of the city. And it's great to see how we can use the strong partnerships that we're developing across the city to work to deliver these initiatives that are making a difference at a local level. So thanks so much for that, and we'll get into more detail at the Q&A slightly later. So thanks, Siobhan. Our next speaker is Louise Mackenzie from the Scottish Pantry Network. Prior to joining the Scottish Pantry Network, Louise worked as a policy manager in local government, specialising in equality, public health and performance management. And she was also one of the core group that we worked together with when we were developing the Glasgow City Food Plan, along with other partners. She has a keen interest in evidence-based policy, community-led development and implementation of practical solutions to policy changes. Louise is going to speak to us today about the Scottish Pantry Network, and you've heard a bit about what they are doing in partnership with Alexandra Rose and Thrive Under 5 in O'Casey. So we're looking forward to hearing more about that. Thanks, Louise.
Thank you very much, Jill, for a very nice introduction, and thank you to Jonathan, Ashley and Siobhan for the very informative and thoughtful. I'm guessing that everyone that is on this call has a background or interest either in food system work in public health, so this won't be news to you, but I think it is worth just reminding people about why we're here and why we're doing these things. Food insecurity is at incredibly high levels in this country. We have the concept of modern malnutrition, and it's not only the financial barriers to accessing food, but also structural challenges, particularly in cities like Glasgow, areas that we know as food deserts and conversely food swamps where environmental bads cluster. And certainly when I worked in the council and I had a little bit of a remit to look at public health issues, it just became increasingly clear that we needed to take a food systems look at all of this to address a lot of the challenges that we face. And again, this is just some of the policy context for the work that we're doing in Scotland. I'm mindful there may be some colleagues from out with Scotland on the call, but just to say Scotland does have the Good Food Nation plan now, which has been out for consultation. It's got some very ambitious outcomes, certainly, and that's certainly the framework for the work that we're doing. And Jill mentioned the Glasgow City Food Plan, which I think it was a great piece of work. It was a very inclusive piece of work. We brought together a very wide range. There's a lot of information on the Glasgow Food Policy Partnership website about this, but it's given us, as Jill said, a real framework and structure. Critically, outcome 1, improving access to healthy, affordable food and reduce food insecurity, and outcome 2, improved health and well-being as a result of improvements in our food system environment. So all of that is underpinned by very real and meaningful partnership. And in the role I'm now in at the Scottish Pantry Network, that is what our model is built on, is on effective partnership. Again, another reminder, not that anyone needs it, but this is a long-standing issue. Food insecurity in Glasgow is very, very challenging. Really tracking it, again, when I was in the council and the introduction of welfare reform by the then coalition government, we saw a very, very sharp increase in the number of food banks in the city, and that continues to be the case, that there are a high number of food bank delivery points in Glasgow. The people that work in them, many of the volunteers, do a critical job because we simply don't have the welfare, social security safety net for people anymore. And the reason I'm talking about this is just to sort of explain a little bit to you about where we evolved the pantry concept from in Glasgow. As I mentioned, we know about food deserts, we know about the clustering of environmental bads, such as takeaway foods and off licenses in the more deprived areas of the city. So when I was in the council, we did a piece of work with our elected members who were very concerned about this. And we realised that there were different models of food support that could provide a more sustainable and long-term outcome, looking both at tackling food inequality and also health inequalities. And Glasgow's first pantry, which Siobhan has referenced in her presentation, opened in Ruchesey in 2020. You're probably aware of a number of other models in the social retail sector, which include things like larders, community fridges. But what these do, which is different to a food bank, is offer choice and dignity in the model and provide people with more sustainable support. So the Scottish Pantry Network as a charity is now working with a network of 23 or 24 community-led pantries across Scotland, and we're currently in 9 local authority areas. And this is our ambition. This is the model that we are encouraging all our member pantries to work towards, that the community pantry, it is community-led, it has the look and feel of a shop, it's in the community, possibly on a local high street, it's open to everyone, it is not a means-tested support, but partly through the support of Fair Share, the food redistribution charity, and other mechanisms and grant funding, it is able to run on a subsidised level. So for example, if you pay £3 or £3.50 for a shop, you will receive goods worth between £15 and £20. But the food is only part of the model we are promoting. So around the food, there are a range of different supports. These will vary from pantry to pantry, and the pantries are in different stages of development. But for example, you will have a community cafe, you will have community meals, you will have advice service on site, such as welfare and energy advice. You will have local growing spaces. So there's a range of different supports that are provided. So it's somewhere that people know, it's in their community, they are supported in a dignified fashion. Yeah, and this is a little bit about us, our vision. We want a sustainable network of pantries across Scotland, and that's just a wee picture of the team. I do have our Chief Executive, Mandy, available later for the questions and answers, particularly if there's any hard questions. Little bit more about what we do. So we're really here as a support and a voice for the pantries. So some of the interesting things, Siobhan's also touched on the partnership that we've got with Ruchesey Pantry and Alexandra Rose, and we very much saw Thrive Under 5 and the Rose vouchers as very much complementary to what our pantries are trying to do. So building that into the pantry model, and as Siobhan said, it would be good to be able to expand that. It is funding dependent though, but we continue to work and look at options to do that. A slightly out of date slide, because we do now have more than 22 pantry members. Also worth saying that we do also provide a delivery service to some of our pantries in Glasgow from the Fair Share depot. And another development that has just started this year, we were successful in getting funding from National Lottery. So we are growing, we are working with a farmer just outside the Glasgow city boundary to grow food for direct supply to our pantries. So again, our partnership with Fair Share is really important, but we need a diverse source of food for our pantries. So that would be locally grown food available in our communities. So we're very, very excited about that development. Some of the work we do, we're involved in a number of partnerships, including Glasgow Food Policy Partnership, the Cash First Partnership. We're play an active part in different campaigns around tackling poverty and health inequality. And yeah, as I say, we continue to try and work to raise awareness of different models and supports that can both tackle food insecurity and health inequalities. Actually, I'm very cheekily here sharing the work of one of our pantry members who I think might actually be on the webinar, but they carried out a survey of the people that were using their pantry service, and these are some of the very, very positive outcomes. So I think we would know this without carrying out the survey, but I think the survey just gives us that evidence base to show that the real impact that providing a pantry model type service with wraparound services can have in a community. And you'll see it obviously improved financial situation, community connections, good for physical and mental health, importantly, reducing feelings of social isolation. Thank you very much. Thank you.
Thanks so much, Louise. That was a fabulous run through of the development of the Scottish Pantry Network and some of the impacts that it's having. And so, yeah, please, if anybody's got any questions, please pop them in the Q&A. Thanks to you all again for really fantastic and very well-timed presentations. So that means we've got lots of time for questions. One of the ones that's coming in, one of the questions that has come in is in relation to ethnic minority representation. And the question is specifically about the Glasgow project accessing fruit and veg. So I think that's about Thrive Under 5. But I see Jonathan has noted that 30.2% are from ethnic minorities in Glasgow, and I think that will be 30.2% of people receiving Alexandra Rose vouchers. Is that right, Jonathan? In
That's
Glasgow.
correct. Yeah.
Are from minority ethnic communities. Siobhan, do you want to say anything about Thrive Under 5? And indeed, Louise and Mandy, do you want to say anything about ethnic minority representation in the pantries as well?
Yeah, in terms of, we were really, I suppose, when we were setting up, like for the meal packs, for example, we were mindful of the needs of the diversity of people who would be accessing it. So we did look to actually try and provide that range, but vegetarian foods, so that there wouldn't be an issue with regards to different, meats and things, but also due to budget, it kind of sorted that it was vegetarian meal packs that we were doing. But also when we were doing the videos and things, we also were trying to make sure that we didn't have any talking in the videos. It's all very visual, so that it could, it wouldn't be a barrier in terms of language for people to access. But it is something that we're constantly mindful of, just in terms of meeting the needs. And I think with a bit more now for the extra couple of years as well, it's just to further grow that. There has been some information that we will benefit from as well from Government Community Project about looking about pulling together advice on culturally appropriate foods and religious foods that are compatible with religious diets. So we look to take that advice on board as well in relation to our further developments and the offerings and the work that they've done too.
Great, thanks Siobhan. Louise, Mandy, do you have anything to add there in relation to the Scottish Pantry Network and for example, the portion of members that are from ethnic minority communities? I don't know if you have that data.
I don't have that data as such, Jill, but I think we know from our member pantries that, particularly in Glasgow, a number of the pantries have a high number of users of their service who are from ethnic minority communities, and I know that in turn they very much try to look at the food supply that they have and make sure that they can respond to that. So yeah, I mean, Glasgow is the most ethnically diverse city in Scotland, so it is something that any community-led service, I think, would be very mindful of.
Thanks, Louise. Just in terms, I was wanting to ask Siobhan, in terms of Thrive Under 5, have you had feedback from some of the frontline health professionals in relation to, the sorts of reactions or impact that they're seeing on the families that they're working with through the Thrive Under 5 programme?
Yeah, we've had some really good case studies that have been coming through, because our referral pathway is pretty open in terms of who can refer in for a family in need. So, and we wanted to design it that way to make sure that everyone who had a relationship with a family could have that opportunity to be able to signpost. So health can make a referral in for Thrive Under 5 support. Those that work in early years settings, those that work in community settings. So when we find out about the work, so from our health professionals, we hear firsthand about the difference that it can make in terms of when that referrals went in, about people that are cooking from scratch. Sometimes it's for people from the first time, and I was just having that confidence of being able to do that. For those that have been receiving the fruit and veg as well, it's just the whole kind of, the package of support really does resonate well. It's just an extra helping hand to help people along. So yeah, I mean, it's been good. We've had good feedback. I think the information that we get from our financial inclusion provider, Money Matters, in relation to case study, really just shows us the in-depth support, because with the financial inclusion pathway, there can be families that they start off in a referrals made in, and Money Matters are working with that same family for over a year, for example, if it's quite complex in terms of the range of needs that family would need. And for us, that makes us feel that we're getting to people who really need it. When we hear these stories, and we hear from the support that people had from being able to get their fuel debt eradicated, for example, to being able to access the enhanced supports, to getting extra income on a weekly basis, and so on. So it comes from a variety of places in terms of the benefits. But I suppose in terms of that, that's really, I suppose, the difference with this referral pathway, that we have tried to make it as inclusive as possible, so that if they don't get a referral in from one avenue, it can be picked up elsewhere. And it's us trying to monitor that as we go as well, and avoid duplication, which we have managed to navigate. So yeah, a lot of feedback coming through, which will be reflected in our evaluation coming up as well.
Great, thanks, Siobhan. And that evaluation, we will be publishing that in the next few months, so we can that'll be available on the GCPH website and the HSCP website. I think we'll be distributing it through our social medias as well. In terms of, there's a question here about, and I think it's for all the panelists, but maybe for Jonathan and Ashley in the first instance. So the question is, in terms of kind of past evidence of some vouchers have negative connotations, especially within some areas of the US. And so there's a question here about any stigma associated with the vouchers. And so I think we're thinking here about the Alexandra Rose vouchers. So I wonder, Jonathan or Ashley, if you've got any comment to make relating to potential stigma that might have been reported through Alexandra Rose vouchers.
Sure. No, it's a really good question, and something that we're really really aware of, and want to make sure that it's minimized, and hence the way we've sort of designed the program as being always influenced by the end user. So we've done lots of user research right from the beginning in 2014 when we set this up. So the vouchers were designed by families themselves. So they chose the design of it, super colorful, it looks great, it looks vibrant. We also designed the way that the voucher would be used, because we tested it with market traders, and the thing that market traders were like, well, we wouldn't use a card machine because we're a cash-based economy. So if you made it an electronic card, that wouldn't work for us, and it would slow down the transactions, and then your customers would stand out. So we use vouchers that are £1 denomination, so you can use them just like cash on a market. You exchange them, it doesn't slow down any of the transactions. The trader takes it, puts the vouchers in their pouch in their front pocket or in their till, and hand over the produce. So it's a really smooth transaction. I think the biggest challenge for us, it happens mainly on large markets in London mostly, is where you have street market, for example, in Southwark, that has 9 fresh fruit and veg traders on that street market, and lots of them are not very good at putting up their marketing material, which is basically, we have big posters that say Rose vouchers accepted here, and then families, if they're using their vouchers for the first time, they're walking down the market and they can't see any signage, and they might feel nervous about using their vouchers. So what we've done in Southwark is come up with pricing sticks. So everyone on the market usually writes the price of today's produce on a piece of ripped cardboard box and sticks it in the box of fruit and veg. So what we did, we created plastic pricing sticks that they can stick into their box, and they can write with their marker pen what the price is for the day, but it says in big bright colors, Rose vouchers accepted here, to make signage just a part of the way that they run their business, so that everyone can see that it's accepted. But it's a very good point. Making sure that we reduce stigma is key. The feedback that I get, and I mean, Ashley, you work more closely in Glasgow and you see families more often, but the biggest complaint that we get is market traders not putting up their signage. I haven't heard much feedback on stigma in usage of them, but Ashley.
No, the only thing I would probably add is that education for the shop or stall owner is really important. So in Drumchapel, food fair was like an addition to what we had in Bridgeton Market. And the staff in there initially weren't aware that the vouchers were being taken. So it was just around educating the staff to take the vouchers and therefore not make it into a big deal. So they just took them just as they would cash or card. And I've had positive feedback from that since, to say that families are quite happy to spend, the staff take them just as they would any other form of payment. So I would say the education for the workforce as well as the families knowing where to spend is important as well.
Yeah, and just one last point, like, we all love vouchers, right? Like, we've always used vouchers. You used to get those coupon books when you were kids, and I used to love pulling out the voucher. So there's something about vouchers which are kind of accepted mode of transaction, which doesn't make people stand out or feel it reduces the stigma. I can't say it eliminates it 100%, but I think it does reduce it quite significantly.
Thanks, Jonathan. Siobhan, I wonder if you've got anything to say there, because you mentioned that the uptake of the vouchers or the use of the vouchers is very high. The redemption well over 90%. How does that compare to the uptake of or the redemption of perhaps other schemes? Best Start, for example, is it comparable? Do you get is there any indication there might be some stigma attached to the Alexandra Rose vouchers?
I suppose on that, what I would say is I think if I use Rukesi for an example, just with us speaking about Rukesi Pantry today, because they know the families as well, although it is a voucher scheme, they know the families that are coming in what they get. So they don't even really technically need to do the transaction as such and make a deal of it, because it's such a regular and they're getting that relationship. And I suppose that's the difference as well when you're in a community and it's the people really, really well. So there's been no problem in terms of redeeming them. And I would say as well the same, we haven't had the feedback about any kind of stigma from the Drumchapel area either. But if obviously if we do hear things, then we will feed it back in. But for now, it's people are happy to receive them and use them in the sites where we have it running.
Great, thanks. And I suppose the other added benefit, which Paul has covered, which Jonathan has covered, is that the use of the vouchers does make those food outlets more economically viable within those communities. So they are of benefit to people who are not in receipt of the vouchers as well, because that food outlet remains in the community. Another question here about how community food growing projects align with the projects that we've talking about today, and whether there's the possibility of connecting them up to encourage people to grow or connect to local food growing. I'm going to hand that or pose that question to Louise and Mandy, because you have mentioned your farm project, but I think also there might be some pantries that are looking at developing some local food growing or developing relationships with local food growing projects. Louise, have you got any thoughts around that?
Yep, sorry Jill, I'm going to answer that.
Oh great, Mandy, thank you.
So yeah, I mean, we encourage pantries to access growing spaces, and we encourage them to link up with growing spaces that are around about them. So for instance, Parkhead are linking in with the growing space in Shettleston, but as Siobhan said, we are speaking about Ricasey today, and Ricasey, they are looking at developing their own growing space as well. And so they've got a piece of land across the road from them, and so they will have growing spaces. What the growing space does is produce food, obviously, but obviously, what it also does is it provides people with access to the knowledge of growing and being able to do it themselves. And there's a lot of research around about the well-being of people as well when they access growing spaces. So there's more benefits than just the food that comes off of that. For our growing project, what we plan to do is have volunteers and an employability project around about that. So the farm that we are working with is just outside the Glasgow boundary. It's up in Torrance in Eastern Bartonshire. And so we plan to use that as well as a bit of an employability, a bit of volunteering for people who want to just do a bit of volunteering. Again, linking it in with training, and having that food that's grown locally, sourced locally, and then coming back to the community. The other thing about the farm that we're working with, they have recently had a piece of research done through the James Hutton Institute as well, which shows that the food is of equal or better nutritional value than the food that is shop bought. So that's really quite positive as well. So there's no pesticides or fertilizers or anything like that used in the food that we grow in as well. So really starting to get the environmental aspects up as well.
Great, thanks, Mandy. That's really, really helpful, and I think it's probably also worth saying that across the wider food plan in Glasgow, the Glasgow City Food Plan, we are looking to develop and support community growing, and also to develop more urban growing spaces and market gardening, so that we do have more locally grown fruit and veg that is able to supply a range of different retail options, including pantries, including community projects, but also potentially local procurement contracts as well. So that is part of our longer term plan. In terms of another question here is in relation to research, and is really thinking about Rose vouchers and possibly wider than Rose vouchers as well, the Pantry Network as well, thinking about joint academic research on fruit and veg consumption. And I just wondered if Jonathan and Ashley or Louise and Mandy had anything to say about any work looking at partnerships with the academic sector in developing potentially some published research on what is being achieved. Jonathan and Ashley, do you want to go first?
Yeah, I think we're really always open to a partnership with academics on research. We worked with some researchers at Sheffield University testing a voucher approach in Barnsley a number of years ago, and we're working with Queen Mary University in London now, looking at evaluating our Tower Hamlets work. I think I said in the answer on the chat that the academic research is really great, especially when you're trying to make arguments with policymakers, but also policymakers. Well, I think it's very clear from our side of things. There's a strong evidence base for this work. The US, of course, it's much bigger, but you can see the academic research there. It's huge. There's a variety of academic work that's proven the model. And I think, we really need, for policymakers, we really need to tell the story really well with the evidence. The evidence is key, but getting the story really clear and making sure that they, in the end, policymakers like a good story as well, as like any of us do. And I think the evidence base and the academic research backs it up. But I think we've got a really clear story, especially in the impact of the work in Glasgow. It makes a really compelling story, and I think policymakers will be interested in it.
Thanks, Jonathan. And I think I was struck by some of the data that you presented in terms of the increase in fruit and veg consumption. You talked about 7% going up to 64% amongst children, and an increase by 3 portions of fruit and veg a day for families. That's really impressive. And I think, given that for as long as I've been in public health, which is a long time, we've really made very little progress on addressing or meeting our healthy eating targets, our Scottish dietary goals, or our fruit and veg targets. It really is impressive that an intervention like this is having that impact. Louise, Mandy, do you want to talk anything about any potential academic partnerships?
Yeah, well, it's certainly something we're very, very open to. I suppose, just following on from what you've said, Jill, and also Jonathan, I kind of think for the interventions that we've talked about today, as Jonathan said, there's loads of data and evidence backing up the positive impact of these types of interventions from out with the UK. And I think I feel a certain frustration, having been in the public sector for a long time. And as you said, Jill, we're just not shifting the dial that much in terms of dietary related ill health. We have the Good Food Nation ambitions, which are they're very ambitious ambitions. And we really need to do something to shift the dial. So I think we have the evidence. I think it's very difficult, I think, for government and councils, because of the need to set balanced budgets, to shift funding from tackling the everyday issues and dealing with the problems to preventative measures. But I kind of think if we're going to meet these ambitions, that's what we need to do. We certainly have the models. I think the work, and what we need to do next is scale those models up. I'll pass over to Mandy, because she might have something more on point to say.
Just to say that absolutely we are open to working with academic researchers. We do have John McKendrick, who is on our board as well. So we are linked in with the academic world, and yeah, absolutely, we need to make that case.
Thanks so much. Yeah, I think one of the other things that's been touched on in the course of today's presentation is the number of neighbourhoods that don't have local access to affordable, nutritious food, and the pantries and the Rose vouchers and Thrive Under 5 is all addressing that by making affordable access easier in some of our communities that don't currently have that. And I think looking to the next few years of the food plan and thinking about what we're trying to do both nationally and locally, it would be to try and improve local access so that people can step out their front door and be able to buy fruit and veg, decent quality, affordable fruit and veg locally, and not just a tobacco, alcohol, lottery tickets, which is what most people can access in their closest shop. In terms of other questions that we've had, then there's just a question here about fruit and veg prescribing, and it's a question about potentially whether fruit and veg prescribing would work for purchasing meals in restaurants as opposed to produce at markets. And the questioner is thinking about barriers such as time to cook and social isolation, and how we could think perhaps differently about how we might use that fruit and veg prescribing opportunity, not just to provide produce, but to provide opportunities to eat with others. I know you spoke, Louise and Mandy, about how the pantries are expanding to community meals and shared meals and opportunities for people to work together. And I know through Thrive Under 5 there are lots of opportunities as part of that programme for families to come together to share learning about a whole range of different things. But Jonathan, with that specific question relating to fruit and veg prescribing, are there any examples of it being used at restaurant outlets or even community restaurants, or is it only at markets at the moment?
Yeah, I mean, our work at the moment is only with markets and fruit and veg. But interestingly, I was on another webinar yesterday with the Bridging the Gap project, and there was a speaker from Belgium, and in Belgium they're testing a different approach to financial incentives, but they're testing a social security for healthy and sustainable food, and it's basically built into your welfare payments a certain amount of money a month. I think it was 120 euros a month, and you can spend that on a range of category of food, but it's all linked to health and sustainability, but restaurants were included in that. So could be an interesting model to look at. I can find the link and put it in the chat. You're on mute, Jill.
Thank you. No, that's really interesting. We can circulate that information to everyone who's been on the webinar today. And then, Paul, we've just had one final question here about the new bridges being built around Glasgow, and whether or not there's been any thought put into what new routes of access these might bring to opening networks or partnerships. So that's an interesting question about the new developments in Glasgow. I don't know if in terms of the pantries or in terms of thinking about the particular neighbourhoods, in inverted commas, that our health improvement teams work with, there's been any thinking about the impact of the new bridges and what opportunities they might bring to our partnership working in the city. Louise, Mandy, Siobhan, have you been part of any thoughts or discussions around the potential of them?
No. I mean, it's clearly a very positive development because the areas I kind of know, particularly the area around the Stockingfield Bridge, and I think it's made a big kind of impact there in terms of people being able to connect down to Maryhill Road. But no, I think it's certainly something to think about. So
yeah, thanks. Siobhan, anything to add to that?
I don't, but I do think it's a really interesting point to raise, and one that through our food plan discussions as well, it would be good to think about that in terms of how the access is opened up in relation to even advertising and promoting what's available in communities where we can and where there's capacity to do so. So no, it's a really interesting point that was raised there.
Thanks so much, Siobhan. I'd certainly know that in Glasgow Centre, here in the Glasgow Centre for Population Health, we are involved in a piece of research looking at the impact on communities on either side of the Sighthill Bridge, and exploring not just around partnerships relating to food access, but more generally around the impacts that they feel that that bridge has brought to them, both positive and negative. So that work is ongoing just now, and we will be completing that work over the next few months. So yeah, keep your eye on our website for more information. Okie doke. So I think I will bring today's webinar to a close a little bit early today, because all the speakers ran perfectly to time, which is fantastic. So what I wanted to say before we close today is again to thank our panelists for their fabulous and informative presentations today, and to thank all those people that submitted questions. If your question wasn't answered today, we'll send them all to relevant speakers and we'll follow up with emails with the answers to you in due course. I want to thank you all for attending today, and I want to thank the team that have organised and helped us to organise today. Carol, Berenger, Rika and Talia, huge thanks for making this all run so smoothly. The webinar today was recorded, as I mentioned at the beginning, and it's going to be made available after today. It was part of our Food Policy Partnerships webinar series, which we've developed to support the Glasgow City Food Plan, as I said, and we will be organising another webinar before the summer that will take place in early June, and we'll be publicising that very soon. Finally, a thanks to everybody who participated and contributed today and made it a really informative hour and a quarter, which I hope you really enjoyed. So thank you very much and enjoy the rest of your day.